It's 3:30 p.m. on Friday, April 3rd, 2020. Thank you for joining us. I am Janet Hill, the Chief Operating Officer at the Rock Island County Health Department. We are joined by Nita Ludwig, Administrator of the Rock Island County Health Department, and Ed Rivers, Director of the Scott County Health Department. They both will give prepared statements today. Following their statements, each will take questions. Please type your questions in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. As for cases, in Rock Island County, we have 4 new cases of COVID-19, bringing the total to 25. All of the patients are isolating at home. Ed, what are Scott County's numbers?
Today's announcement was an additional 6 cases for a total of 31. So let's talk a moment about the changing environment surrounding COVID-19. You'll remember that when it was first identified in China, it was called a novel or new virus, and this was because the virus had not been found in humans before. And that means our response to the virus is also new, and we're doing things that never been done before on this larger scale. So each time an individual tests positive across the country, we in public health and the healthcare system learn something new about the virus. We know that symptoms of someone experiencing COVID-19 have been fever, cough, and shortness of breath. But we're also learning that other individuals have been found to have COVID-19 and have experienced more mild symptoms. These symptoms include respiratory infections such as runny nose and sore or scratchy throat. The fact that COVID-19 symptoms can range from mild to more severe is one of the main reasons we're asking you to stay at home. The more we limit ourselves from interacting with others, the more successful we're going to be at limiting the spread of the illness, especially from those individuals who have mild symptoms and those who may not know they have COVID-19. And think of it this way. You're not going to catch COVID-19 if you're not around lots of people. The same can be said of someone who may have had mild symptoms of respiratory illness. You can't spread COVID-19 if you aren't out and about with other people. So stay at home as much as you can, even if you got no symptoms. Definitely stay at home when you show any symptoms of a respiratory infection, because staying home saves lives. And, you know, we know this is tough, and we're asking each of you to do lots of tough things right now, such as don't host play dates or sleepovers for your children. Don't participate in group outdoor activities. Don't allow your children to hang out with groups of friends while school is out. Don't go to stores and just browse to get out of the house. Does this sound extreme? Well, yes, we know it does. But the spread of COVID-19 in our community is very serious, and staying at home saves lives.
Thank you, Ed. Now we'll hear from Nita Ludwig with the Rock Island County Health Department. Nita?
Good afternoon. With so much time being spent at home, you probably feel like all you're doing is cooking and cleaning, and I do too. We're here to help make sure you understand how important cleaning and disinfecting is to preventing the spread of COVID-19 and what you should do when someone in your house is ill. What should you do to clean and disinfect? Wear disposable gloves to clean and disinfect. Clean frequently touched surfaces, such as countertops, doorknobs, bathroom fixtures, toilets, television remotes, phones, and other everyday things. Consider the other soft surfaces too, such as carpeted floors, rugs, and drapes. And vacuum often. Laundry items such as clothing, towels, and linens. And how do you clean and disinfect? Well, first you clean and then you disinfect. You can clean areas with soap and water or some other type of detergent. Then use a household disinfectant as indicated on the package label. Alcohol solutions with at least 70% alcohol can disinfect. Diluted household bleach is a great disinfectant. For diluted solution, you can mix 5 tablespoons of bleach per gallon of water, or mix 4 teaspoons of bleach per quart of water. Wash laundry very well and wash anything with blood or bodily fluids right away. For electronic items, consider putting a wipeable cover over them. When you're living with someone who is sick, if possible, have that person stay in their own room and use a separate bathroom if possible. This includes during meal times, have them be separate. If a bathroom is shared, the sick person should clean and disinfect after each use, or the caregiver should wait as long as possible before cleaning and disinfecting. Only clean the area around a sick person when needed to limit contact. If face masks are available, have them wear a face mask when you are around them. Avoid sharing household items like dishes, glasses, towels, bedding, etc. whenever you can. Wear disposable gloves while handling their dirty laundry items, used dishes, or silverware. Wash your hands after interacting with them or handling the used items. If possible, have a dedicated lined trash can for that person who is sick.
Hi, this is Janet Hill again. We had asked media if they had specific questions to send them to us ahead of time. So we had a couple of questions sent to us by Michelle O'Neill at WVIK. So one of our first questions was, we would like someone to provide context of the confirmed positive cases in the Quad Cities. Have the cases been identified through contact tracing as coming from outside the Quad Cities or as community spread? Nita, what do you say to that?
I would say most of them have been community spread. Like we've been saying for weeks now, the virus is widespread in our community. We do have at least one positive case that was travel related.
Anything that's different for you, Ed?
No, much the same. Our first two cases here, you'll remember, were not Scott County residents and were travel related. We do have community spread. We said this was the case and continue to maintain it. With regard to contact tracing, identifying cases from coming out from outside the Quad Cities, that's not the primary function of contact tracing. When we interview people and do contact tracing, we're looking for people they might have come into contact with and to whom they may have spread the disease, not necessarily determining where they acquired the disease.
Okay, so is it safe to assume that most Quad Cityans who get the disease have been spread through community spread at this point?
I think the cases that we're seeing, except for the couple that were travel related, are community spread, yes.
Yeah.
Do we have any idea? Oh, I'm sorry, Nita, please go ahead.
That's okay. I was going to say the majority on the Illinois side are community spread as well.
Okay. Do we have any idea whether they are asymptomatic or pre-symptomatic patients?
We have no idea at this point.
Here's a couple of questions regarding the number of hospitalized patients. Nita, how many hospitalized patients have we had and how many have been discharged?
So we remain at that number of 5 that are hospitalized at this time. I think when I originally got the question about number of hospitalized a couple of days ago, we had already had 2 people that were hospitalized that have now been discharged. So we remain at 5 hospitalized and 2 have been discharged and are at home.
Okay. Ed, do you have those numbers for Scott County?
We don't currently have those from Scott County. Our system is different from Illinois, and that's not something that's routinely given to us, although we are working on a method for acquiring that data and hope to have a report for you in the coming days. I will note that on the Iowa Department of Public Health website for the state of Iowa, they note that there are 80 currently hospitalized, 58 who have been discharged, 415 who have never been hospitalized.
Okay, that's good information. Thank you. On average, do we know how long it takes for a hospitalized patient with COVID-19 to recover? Nita, do you have that?
Yes. According to the Johns Hopkins website, those with mild cases of COVID-19 appear to recover within 1 to 2 weeks. For severe cases, recovery may take 6 weeks or more. and about 1% of those infected worldwide will die from the disease.
Okay. Ed, anything to add?
No, I think that pretty much covers it.
Okay, thank you. The last question that we had earlier was, has anyone with COVID-19 who has been isolating at home fully recovered? Do we even have access to that information, Nita?
Well, on the Illinois side, those that we know that are positive, that are isolating at home, it has not been the full 14 days yet. So we do not have information about being fully recovered yet.
Anything to add, Ed?
As I said, we don't currently have that information, but if it's available to us through our inquiries, we'll add that to our panel of information we'll be giving you in the coming days.
Okay, thank you. Michelle, we appreciate you sending the questions earlier. As you know, that's the way that we can give the most complete information to you. Brooke, what other questions have popped up in our chat box?
We don't have any questions as of the moment. We are going to get an update from one of our community partners. We have Kirby Wynn from the Mississippi Valley Regional Blood Center who's going to give us some updates. Kirby, you want to go ahead?
Yes, hi. Mississippi Valley Regional Blood Center is announcing today that we will collect plasma donations from patients who have recovered from a COVID-19 infection. And this is to help newly diagnosed patients fight the disease. The treatment is known as convalescent plasma therapy, and it requires plasma provided by donors who've recently recovered from a COVID-19 infection. These donors will have antibodies to help fight COVID-19, and it's a treatment that's been used previously in recent years to treat victims of Ebola, SARS, and H1N1 influenza. I just have a few details on how this will work. I also have a full news release that I'll distribute here after this call. To provide convalescent plasma, donors must be fully recovered from their COVID-19 infection. They must meet all standard eligibility criteria for blood donation. Plasma will only be collected from donors with laboratory confirmed tests showing they had a COVID-19 infection, and the donor must be at least 14 days from the last date they experienced symptoms. And that's all I have on that, but would be happy to respond to questions through the chat. We also have on the line our Director of Donor Services, Pete Lux, who may be able to provide more specifics on that depending on where we go with questions.
Thank you, Kirby.
Thank you, Kirby. We will go to the chat now. So we do not currently have any questions, so we'll put ourselves on mute and give you a chance to put any questions in there that you might be interested in asking at this time. Kirby, we do have a question on here about the convalescent plasma. They are interested in hearing how that effort began. Can you give some information on that?
I can, and Pete is in another office down the hallway, but if you'd like to chime in, I'd welcome that as well. We'll just
Sure.
identify.
I can add a few things to it. This is
Yeah.
Pete Lux, Director of Donor and Patient Services. So this convalescent plasma process has been used to treat other viral infections, including Ebola, SARS, the MERS, which was those last two are coronaviruses. So we, now that we have COVID-19 pandemic running through the United States, that we want to do it here as well. It's mostly been used in other countries where the pandemics were experienced there for those other diseases like Ebola, SARS, MERS. Whereas here in the United States, those diseases never got to be to the point where COVID-19 is right now. And that's why there's not only Mississippi Valley Blood, but other blood centers are making the push to provide this product, much needed product to patients while they are suffering through COVID-19.
We have another question in addition to that. When do you expect to see the donations start to come in, and who has asked the blood center to do this?
We've been asked by several hospital partners to provide this product. Kirby can probably speak to which ones or how many, but this is a product in demand from several doctors and hospitals that we currently provide blood and blood products to.
Well, that's right. We're seeing the push for this nationally. Other blood centers like our own are making similar plans, or may even be collecting donations already. So it's a, I don't want to say a new treatment, but as Pete described, it's something that we've seen more of in other countries, but we are ready to carry this out with our own processes and make these antibodies in the plasma available for patients. And so the interest is high among the hospitals we work with. There are 115 hospitals in what we just refer to as our service region, from Madison, Wisconsin down to St. Louis. And that's all of the blood components that are transfused in the Quad Cities area, or all of the local hospitals work with Mississippi Valley on their blood supply. So high level of interest across the board. And then for Jarek's question about when we expect to see the donations start coming in, Pete, maybe you want to address that, but it seems
Sure.
at least a week away, but go ahead and maybe explain why that is.
So currently today we wrapped up our final regroup meeting to discuss our processes. We will be making the referral form available online very soon, either in the next couple of days, for a physician to refer a recovered patient to us who will be a potential donor and not a patient for us. Then that we will do our screening with the patients, the potential donors, and get them scheduled. We're looking at maybe getting them scheduled later next week, or at the earliest the week after that. There is one thing, post-recovery, if they're within 14 to 27 days of the 14 to 27 days after their symptoms subside, we must have a negative COVID test. If they're beyond 28 days, that test is not required. And I really want to make it clear that a positive COVID test is a requirement to be a donor of this plasma at this point. That is an FDA mandate, and that there's no, right now, that is definitely a requirement. It can't be someone who was presumed positive without that test result.
We have a couple of follow-up questions on that topic. Are there any cases of COVID-19 that have successfully been treated using this process?
To me, not to my awareness. This is Kirby. I think I would say we're very early in the process of making the product available. Although it is a proven method of delivering antibodies to the virus. Like as Pete referenced earlier, in the case of SARS, another coronavirus.
And MERS.
And MERS, yeah. Go ahead, Pete.
Oh, sure.
Better
so actually, I don't know that any donors are at a point where these antibodies would be collected and have been transfused to a patient yet, because COVID-19 is so new to the U.S. that, this is taking some special information from the FDA to get up and running. So I believe that some products have been collected, but I don't know if transfusions have started anywhere. But the SARS and MERS, which are both coronaviruses very similar to COVID, the patients who received plasma with those antibodies did see some improvement, and some their symptoms were lessened from this treatment.
We did. I should mention too that Dr. Lewis Katz, who's been advising and working with us, of course, at the Blood Center on all of this, had a direct conflict right at this time, so he's unable to join on the call. I did hear him in an earlier meeting mentioned that he was in touch with some people in China who've been using this kind of a treatment, and they're a little bit further along there in terms of the outbreak and patient care and so forth. But that's just a secondhand comment from a meeting that you probably can't work off of. But I did want to mention that Dr. Katz, of course, has been working on a lot of this with the blood center and just couldn't join us during the media briefing.
Yeah. The blood supply
Kirby,
is.
want to give a...
Oh, go ahead.
Nope, I was going to ask you to respond to that, so please go ahead.
Pete's team has been busy. Go ahead.
We have been very busy we've made lots of changes with all the blood supply currently is very strong because of the dedication of the donors, not just in the Quad Cities, but throughout our entire service region. That has come with many thousands of units being canceled off of our blood drive schedule because of schools closing, businesses not operating, and people, stay at home not wanting to have blood drives. But our donor centers have been very, very busy. We've done lots of rearranging of scheduling with blood drives to accommodate when schools are going to reopen, if we could have a blood drive there. So that continues to be a work in progress, but currently the blood supply is very strong. So for anyone who would like to donate, we ask that they wait a few weeks, call and make an appointment. With the requirement for social distancing, we are taking appointments only, so we can go to bloodcenter.org and find the information for making your appointment. And I'll let Kirby speak to the more marketing side of all that.
Well,
that's his specialty.
This is just very unnatural for us at the blood center to not speak in terms of an immediate need for donors, but that's where we are right now. But I think our experience is knowing that this won't last for very long. There's a lot of kind of competing factors, and we still need to book blood drives that have been canceled off of our schedules on into the end of April and May and certainly early summer, because the use of blood continues. And we're being very flexible, and Pete and his team, they've made a lot of changes and adjustments, but we want everyone to know there's been a great community response and we're in good shape right now, but we've got to keep our eye on the ball in the weeks and months ahead, because this is not going to be a short-term event.
And I do want to say that our donor services team and donor recruitment, for that part, although not providing direct bedside care, are considered essential personnel, and they have all stepped up to the plate to continue having blood drives when we can, to work at the donor centers with the public as they come in. So I'm very proud of that, and our whole organization for for keeping the blood supply going, for being so prepared to collect convalescent plasma.
Thank you both for that information and for sharing that with the community. We appreciate that. It looks like we do not have any additional questions at this time. There is some information that has been just shared in the chat on convalescent plasma, so please feel free to check that out. Additionally, we do want to share some additional information with you. We have had a video that's been created here in the community, and that is Together, sorry, the screen just moved there, Together Quad Cities, Keep Staying at Home. We've had both Nita, Ludwig, and Ed Rivers participate in this, as well as a number of elected officials in the community. And this is available on YouTube. We will be sending you these links. It gives the strong indication for the community on the need to keep staying home. We know we've asked a lot of them to stay home in the last couple of weeks. However, we have to keep it going, recognizing that staying home saves lives, especially for those who are most vulnerable. There's some additional information that's been put out. We have a PSA that the Iowa Department of Public Health has provided. We do have an additional radio PSA that we'll be sharing with you. And then again, we want to make sure to provide information to Together Quad Cities, the website, which again is acting as a hub and a landing spot for the community, for whether it's media, community partners, the public, to get information on the response to COVID-19, as well as resources that are available in the community. So we encourage you to check these out, and if you're able to, share the Together Quad Cities message that our elected officials have been providing in order to assist us in sharing that message of keep staying home. Again, thank you very much. We look forward to talking with you again next week.